Hello, I'm Dr. Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and also from Smiles of Salem in Salem, Massachusetts. So I commonly get asked a number of questions on tooth decay, so I'm going to be answering some of those questions for you today. So a lot of patients do ask this question, what is tooth decay? So tooth decay is actually a tooth disease, so it's caused by bacteria. So tooth has different layers which its teeth are made of. So bacteria eat those layers and that creates a tooth decay. So another question that I get asked is what causes dental decay? So dental decay is caused by bacteria primarily. We all have different kinds of bacteria in our mouth. There are some bacteria which are more aggressive than the others and they cause dental decay. And also there are different conditions that can lead to, how sometimes some patients are susceptible to have more decay, some are susceptible to less decay. So there are many other factors that play a role, and one of them is actually more common ones is people not having too much saliva in their mouth, and that can be caused by various reasons. And out of that, most common is when people are taking a lot of medications. It could be a side effect of those medications, and it also could be if some patients have some gland issues, because, for example, like somebody had unfortunately cancer and their glands which produce saliva, they were taken out. So now they are deprived of that function and they don't have that saliva. And also the other thing is, that patients, if they are from their diet, what they're eating, that's inviting more bacteria in their mouth. So those are some of the reasons which can lead to tooth decay. And if it's left untreated, it will lead to more decay and also ultimately to tooth loss. Another question I get asked is, what are the effects of tooth decay? So the effects of tooth decay are it leads to ultimately loss of the tooth. So decay can start as a very small area. If it's left undiagnosed, untreated, it leads to bigger decay. The tooth gets decayed almost to the root and you end up losing the tooth. But if you're getting your regular checkups, you're able to get that treated sooner than later and you're able to save your tooth. So another question I get asked is that can tooth decay lead to other complications? Yes, very much so. So starting from when the tooth has mentioned before, the tooth has layers, typically 3 layers on the tooth. The decay starts in the top outermost layer. If it's not treated that time, it goes down to the second layer. And second layer of the tooth is even softer, so the decay spreads actually very fast in that layer. And then if it's left untreated at that time, it leads to the third layer, which is a nerve of the tooth. And the complication from there is that the patient might start experiencing pain. And pain could range from maybe a dull ache to a very severe pain, which can lead to a patient not being able to sleep at night. Then they're experiencing a lot of pain. If it's even left untreated at that point in time, it can lead to infection underneath the tooth as well too. And complication of that could be again severe pain, swelling in your mouth. Depending on if it's a top tooth, it could even swell your cheek, can go up to your eye, or if it's a bottom tooth, it can lead to the swelling of the lower jaw, and it can also lead to the swelling in your neck as well too. And obviously if it's left untreated, or even at that point in time, the bacteria actually are traveling in your whole bloodstream. And as we know, there are so many other systemic conditions that can lead to that bacteria could get stopped in your heart, can lead to endocarditis, or many other things that can happen because systemically those bacteria are going away in your body. So another question I get asked is, can tooth decay return to normal? So once the tooth decay sets in, there's no returning back. Before actually with the diagnosis today that we have the x-rays available today, as if the decay has very beginning stages with some fluoride applications, it can be reverted. But once the tooth decay has actually set in and the enamel is degraded, there's no way for that to come back. But the good news is that if we can diagnose that it is found at any stage, depending on, so we can restore that. The first restoration is by doing a tooth color filling. So nowadays we have that available. So nobody actually would even know that you have a tooth restored. So that's the good news about that. And if the tooth is, degraded quite a bit, we can restore that with what is called a crown. So it's like helmet around the tooth. And good news is it is also, we have it available as a tooth color. So you will know that you have that. If the decay has gone into the nerve of the tooth, we can do a root canal and we can still restore that tooth by doing a root canal procedure and putting a crown on it. And if it's, degraded so much that we cannot bring back the tooth, we can still restore that area by doing an implant. So another question that gets asked is, how do I stop tooth decay from spreading? So you can stop the tooth decay from spreading is basically treating that decay. So once that decay is treated, there are no more bacteria, so they're not going to go essentially to the next tooth and also essentially in your whole mouth. So by treating the tooth as soon as possible, will stop that tooth decay from spreading to the other areas. Another question that I get asked is, is tooth decay painful? Yes, it will be painful as soon as it reaches to the nerve of the tooth. It can also be painful if it has gone deeper into the second layer of the tooth. It will start giving you pain. It will become painful. So some things to consider regarding tooth decay, it's a silent disease. So a lot of times you will not know until the tooth has decayed quite a bit, and at that time your treatment will be multiple things that you will require, and also it will lead to tooth loss, which means it's time out of your precious day to come to the dentist and also spending lots of money. So one thing to consider is going to your dentist and making sure that you're getting regular checkups so you can avoid all that time in the nano chair and also your expense as well too. Another thing that happens is sometimes, we hear that, the tooth was hurting, but then it stopped hurting. So what happens in that case is actually the nerve died and it could be getting infected underneath, but the tooth is dead. So bacteria actually are going all over in your body, again, giving you the risk, posing the risk towards all those systemic conditions. So we want to avoid that. So make sure you get to the dentist on time as soon as you're feeling any pain, or even if you didn't come at that point, if you're feeling it stop, now get to the dentist, get it checked out so you can be treated accordingly. So I hope I've been able to answer most of your questions. If you have any additional questions or you would like to make an appointment, give us a call, Smiles by the Sea at 603-926-8827, Smiles of Salem 781-631-3799. We are here to help you.